I'm Professor Tullio Ghi. I'm the Chief of the Department of Prenatal Diagnosis here at the University of Parma. I want to explain to you the case that we just saw today. She was a lady that she was at the first pregnancy. She had been referred to us because there was a suspicion of a fetal cerebral anomaly. She had been submitted to ultrasound scan elsewhere, and a gynecologist there have raised the suspicion of an abnormal communication between the fourth ventricle and the posterior fossa. This means technically that the cerebellum appeared smaller and hypoplastic. This may be actually a serious malformation of the baby, and so the patient, even if the diagnosis was uncertain, was really anxious because of that. When she walked in, we had the opportunity to check the anatomy of the brain of the baby using the standard technology and especially using the 3D multiplanar technology. And this allowed us to look at the anatomy of the cerebellar vermis, which is the main key in ruling out this type of anomaly, which is called Dandy-Walker malformation. We could see, using the 3D acquisition of the brain and the reconstruction of the plane in the mid-sagittal view of the brain, we could see that the cerebellar vermis was in fact perfectly alright, perfectly intact, and it was covering, as expected, the brainstem with no particular communication, significant communication between the fourth ventricle and the posterior fossa.
The patient was referred to us for a second opinion. The use of 3D ultrasound, of the 3D software, helped us in this case to be able, in just one image, so in a sweep of the axial plane, we were able to see both the coronal and the sagittal planes. And in these three planes, we are able, in just one sweep, to be able to see all the structures of the brain, and we were able to tell the patient or tell her that the abnormality that had been suspected was there.
At the end of the ultrasound scan, we have used a particular and very recent tool that Samsung machine has developed, which is called 5D CNS. This is a particularly skilled automatic system that allows the operator to obtain a comprehensive view of the main structure of the brain. You just need to acquire a volume of the fetal head. You are asked by the machine to point the thalami and the cavum septum pellucidi, which are two structures very easy to detect and identify also by a basic level operator. And after that, the machine is able to reconstruct the main structure of the brain and to do the measurement of the fetal head circumference, biparietal diameter, and the fetal ventricle and cerebellum. So that was a very recent acquisition that has introduced and reinforced the concept of automutation in fetal ultrasound. So far, we started with 2D. After we had the big improvement of the 3D technology, after 3D we had the 3D in movement, so what is called 4D. Now we reach a further dimension, the 5D, which means 4D with the automotive component, which is the very recent acquisition of ultrasound in fetal medicine. At the end, I would like to mention the fact that this type of ultrasound scan examination are really helpful for the entire team working in a place, because we can store images, volumes that we can analyze separately with our colleagues, and trying to look at the images together. This may help us, for example, to understand which was the best approach in looking at the particular structure, and for example trying to understand which may be the best solution the following time in disclosing a certain type of anomaly or in ruling out a specific type of defect.